Hello, everybody, and welcome to Charm Health's Tech Tuesday at 10. Um, Today's webinar is on optimizing patient engagement in Charm Health. Today, Shesha is going to be talking about several different aspects that are present in our Charm Health software that'll improve patient engagement, including scheduling appointments, filling pre-appointment questionnaires, personal health portals, secure messaging, accessing health records and medical literature, sharing documents with the care team, lab results and RX updates, refill requests, and more. With that, I will pass the baton over to Shesh. Shesh, welcome and thank you.
Thank you very much, Ranjani, for the warm welcome. And hello, everyone. Happy Tuesday. And I hope you're all having a great morning today. So briefly, I'm just going to introduce myself. My name is Shishadri. I work in the sales team. Today, I'm going to be talking about patient engagement. What is a patient engagement? In every aspect of view, patient engagement is very key and a crucial part in every practice when you start, because as you run your business, if you want all the belts and whistles, same way patient also requires all the necessary information and all the necessary components to provide the information that you want to collect, share, and to communicate with them. Without that, without the lack of that components, probably you might lose some patients, or you might gain some patients because of the usability of the software. Patient engagement is centered on providers and patients working together to improve health. A patient greater engagement as healthcare contributes to improved health outcomes. So the better communication, the better engagement you have with the patient, that's what actually brings you the best outcome of your patients. So let's take a quick picture of what a charm can provide it over to you. Okay, so when a patient wants to have a consultation with the provider, what does really require them? First and foremost, communication portal, right? Patient portal is the main key to communicate securely with the providers, with all their issues and the medical information where they can share. And Charm do provide where end-to-end components where when adding a patient, you can register a patient portal, and where patients can self-schedule themselves from a patient portal, and where also you can collect payments. You can also write prescriptions where they can have access to, and you can also embed a calendar. And there are multiple options or many options. Charm will provide it over to you to make ease to your patients to have a great consultation or a great service with your practice. Okay, I'm going to go over the demo. I'm just going to show you a couple of slides. Then I'm going to jump into the system. Then I will walk you through how a patient will, go through the registration process, and they will have a proper communication with you. Okay, let me go ahead and switch to this one. Okay, what Charm offers, as I said, request. One of the main thing is like getting scheduled. So getting scheduled also, it comes with the multiple options where patient can, send an appointment request and also refill request. So these are the two main things where a patient would like to do. So first and foremost, when you add a patient, you can send a portal invitation to their email address. So basically all it requires for them to do is just go, open their email address, and they will have a link ready for them to register a portal with your practice. It will tell you a message like this, and with a link where they can click and set up their portal by just confirming their date of birth. And they can set up their username and password. And with that couple of steps, system will give an access to the patient portal. So once they set that up, all what they do is they go to charmphr.com. and they're going to go and click sign in and put in the login credentials. to get the access. So some of you may have encountered the screen because if you have multiple members, like, family members, if I have a mother and a child, or you could be in a multiple practice. So in those cases, you will see a member section where you see the list of, different patient names and the facilities they're part of it. And once you click the name of the facility, it will bring you to the dashboard. So this is where a patient can access all of their information that are shared by the provider and the information that the patient is going to be sharing with the providers. Okay, so once they're scheduled, now the patient have access to, send a message to the providers, schedule an appointment. So where a friend does do not have to worry about calling the patient to schedule. So self-scheduling is available for the existing patient. And what about new patients, right? New patients, yes, even they could schedule it too. You don't need to have a patient portal to schedule a session with your practice, where you can create an Embed Calendar on your website, which will show your name and details and the services you do offer. This is a very crucial part of a practice when you're new or a beginner starting up your career in this medical field. So as many as you can get, that's as soon as you get, or as easy as you can get, and provide the service. And that's the best way you can see the results as down the road. Okay, so basically, if it's an Embed Calendar, then from the Embed Calendar, you could patients can go to your calendar and see the provider name and select the visit types. So visits are all listed on the bottom, and the patient can schedule any visit that they would like to. If it's an existing patient, they can set up a follow-up visit, and if it's a new patient, there are initial patient visit, or they could do the doctor consultation. And once the patient selects the visit type, they can choose the time. And once they choose the time, the next window, it will be asking a patient, are you an existing patient? If it is yes, then you will have an option patient will have an option to put in a record ID and date of birth to schedule. But if it is not, then not a problem. You could say, are you existing patient? No, then you can go ahead and definitely their new first and last name, date of birth, their gender, and address and phone number. So these are mandatory info that required to add anyone into your practice. So once they input the information, it will be asking to schedule for the reason for the appointment and the image for text. Test reason. And the patient could hit confirm button to schedule and visit with the provider they wish to. So this is how with the Embed Calendar, a new and existing patient could do. But what about the patient portal, right? If they already have a portal, then it's super easy. Once they go to the dashboard, they can click the request appointment on the top of the section, and they could choose the facility, provider name, and what type of visit they would like to schedule. And here it will give options where they can actually select the slots, what time slots or when they would like to schedule. And by just selecting one of the appointments, it will give you a default, whether it's a video consult or in person. It will let the patient know. Or if you allow all three, in person, video consult, and a phone call, then patient gets to choose how they want to schedule. And they can input the reason. And one of the important thing is getting paid. If you are a cash and credit card practice, where you get you do not accept the insurance, then you can collect their credit card details and store card on file. So this way you can go ahead and collect the card details, and you can also deposit a certain amount, like $50 or $60 for no-show fees, or you can collect the entire visit cost, like $100, $150 for an example. You can collect the total amount and store the card details on file. So this way you can keep track and make sure you can provide a best outcome for the patient, so you don't have to keep asking for their payment details to collect the payment. So you can just store and keep it on securely on the portal. On the practice end, you can run the payment, or you can collect the payment at the time of schedule. And once you schedule a patient will be notified via email by default. Email notification will go out, and if you do have a text invoice notification enabled, then it will be notifying patients via text as well that they're being scheduled with this provider at this time and such. And also you can enable like reminders, email reminders or text reminders or phone call reminders. It will go out of the patient and it will remind whatever the days before. You choose 1 day, 2 day, or 3 day before to remind them that they have a appointment coming up, that they will be meeting the provider. So once they're scheduled, a patient will be notified and sent all the documents, consent forms, intake forms, everything into the portal. But how are you going to do it, right? Like a lot of people, I've talked to a lot of clients where they say they have to do a lot of manual process, but Charm what brings is we have made everything automation. So the point the patient schedules an appointment, it schedules in the system and also shares all the questionnaires automatically to the patient. So you can configure all the forms that should go out. For example, if it's an initial patient, like the first time you're seeing them, you can have like a welcome letter, any intake forms, consent forms, such like that. You can configure to each individual provider and each individual visit types. So you can choose the ones you want, and as soon as the patient schedules, it'll be shared and patient can go ahead and fill them up from their patient portal. And also the timeline offers step-to-step actions are done within their medical record. So as you see here, when the patient schedules, it will tell them what time and with whom they're scheduled with, and also the questionnaires that they receive to fill it up before the visit. And also many other options, which I will walk you through. In the timeline, basically, you can access all the actions that are done and also the announcements onto the right side, which will tell or remind or let the patient know what are the announcements you have done to the patient. So I know we have been through all the closures, COVID situations and stuff. In case of any emergency, you do not have to call each individual patient. You can just do an announcement, which will notify all the patients when they log into their portal. And also quickly, it will give them a quick view of their active medication. Okay, so from this timeline, they can access many things, but without timeline, they could also go to clinical summary, which will give complete details of a patient. So here they can access their complete medical history, like allergies, medications, and all the things have been done or recorded for the patient, where you can actually download them or transmit to whichever the member you would like to send the clinical summary to. So this is kind of a bit more access a patient could have, and which is great because they want to know their information. Okay, and scheduling an appointment, as I showed, it is always on the top. The top 3 sections are sending a message, request appointment, and share section. These are the mostly used sections by the patient, so that is available always on the top of the page. If not, they could also go to appointments and check out all the appointments that are coming up. And you can also filter by upcoming appointments, requested appointments, denied, waiting list, and past appointments. So this way you can view the appointments that are done or in the previous dates. And also if it is a televisit, patient will go to appointments and click check-in button to join the televisit with you. So patients can also join a couple of ways. One, they can log into the portal. This is one of the most commonly, heard by the practice, that where patient need a little more flexibility, right? So they don't have to be logged in all the time into the portal in order to access or join the televisit. So Charm had given two options. One, patients can join from the portal, or second, we can enable a way where a link to join, like the link that will be sent to the patient's email address. So if they're using cell phone, tablet, computer, or PC, just by clicking the link, it will grant you an access to start the tele session. So you do not have to be in the portal. So this is one of the cool things a lot of patient likes, because I know they do like to log into the portal, but not everybody. So for them, it will be really helpful to give multiple ways of joining the visit. And next, in one of the most important thing is a communication, portal to portal. So this message, messages are communicated between a secure platform from a patient profile, and they can click compose button and choose a member who they would like to send it to. So from your end, like a practice end, you can enable who would like to receive messages. So those members will only be displayed over here. So that way patient can select the provider name or the staff if you enable it to them. And they can put in the subject and the message, and also it will show how many characters you allow to the patient. So some providers, they don't like to have a lengthier email, so you could limit number of characters that patient can send it over to you, and also number of messages that can be sent it over to you. So which will be patient communication happens between the patient. So this way a patient can go ahead and communicate and attach any of the attachments or documents they would like to share with the providers. And the documents is very crucial, because any copies or any PDF or any labs or any image results, pretty much anything, any documents that they have, they can go ahead and store it and into the patient portal, and they can go ahead and select it and share with a provider if they wish to. Patient portal is not only practice specific, it's also patient specific. Patient can store their personal information, and also they can share it with the practice. So it doesn't mean like whatever information they store here will be reflected, but whatever they share with you actually will be reflected with you, not everything. So the personal portal and practice portal are all bundled up together, so patient have the privacy, and also they can share any information with you. And when you click upload, it's just going to upload to the portal. But when you click upload and share, there you can select the care member or others. When you select others, you can share to anyone with their email address. So that way you can put in an expiry date, 1 day, 5 day, or 10 day. So if a member who's you sent to, if they do not see, or even if they have access after a number of days you select over here, it will be expired and they will not be able to access after the number of expiry date you have chosen. Okay, and questionnaires, I'm just gonna quickly go through this. Questionnaires, any forms that you send out, or welcome letter, intake forms are visible, so patient can go ahead and review the informations that you have sent and submit it. Or if you have let's find consent form. If you send any consent forms, it will be displaying the provider name and the facility details. And the forms can be reviewed, and they can put in an initial, and also patients can e-sign it. So basically you can get most of the documents signed and date when they were signed, and submit. Okay, so you can go ahead and collect it. And also there are widgets we have built in where, patients can input the basic demographic informations, insurance details, and as such, there's a lot more options Charm to provide. But as I said, in order for your practice to smoothly, automate all these processes, you can definitely do so by just setting up your account such a way. And so patients can go ahead and complete these documents and have a great visit with you. And once you do the consultation process, then the important thing is to know what has been done for the patient. And the visit summary will definitely reflect and provide a necessary information that they would want to, know. For example, like, when you have a consultation process, the basic thing is providing a visit summary, patient summary, right? As soon as a provider signs the encounter, and the visit summary will automatically be shared to the portal. So once they receive the visit summary, patient do receive a email notification stating that they do have a visit summary, which they can go and access, which will tell their vitals and their goals, and also what's being prescribed, the medications, supplements, injections, lab orders, and such. These are all put together and immediately shared to the patient portal. So as soon as you finish the consultation with the patient and sign the encounter, they should be able to get the access to it. And, everyone wants to get paid, right? Obviously. So billing component is very crucial when it comes to this. Billing, there are many types of billing. It will be done. So as I mentioned earlier, if your practice would like to collect the payment initially at the time of scheduling an appointment, then it's great. You already got paid, which is good. But if you are the practice, you just store the information and send the invoice later to the patient, then the billing components are very crucial for you to know, because by getting a Bluefin integration with our Charm system, patients should be able to make payments from the patient portal. So for example, as you see, these are the invoices displayed over here, which will show you the amount that they're due for. And also, if they have already paid, the receipts are visible over here when, practice shared with the patient. So for example, patient should be able to make a payment right from the portal. It will show them the amount which is due, and patient should be able to click make payment and select an option. So if a practice enables to make a payment through online, then patient should be able to input the card details and go ahead and make a payment right from the patient portal. So yeah, this way practice can actually provide multiple options, and you can actually decide or plan how you would like to collect payments from a patient. Okay. Just a quick pause. Let me see if anybody have questions. Yeah, just a quick question for Jody. Can the number of characters in a message be changed? Yes, definitely. You can select how many characters you want to send. As I shown, there was a 200. You can have it 500 or 1,000 text characters. So that way, you can limit how much they can, type in a message. Okay. I'm going to get right back into the topic. Okay, so yeah, so billing is very crucial part for any practice to, collect payment or send invoices and receipts, and a super bill. That's one of the key point, where if you do collect a payment and where patients going to, get reimbursed from insurance company, practice can actually share the super bills to the patient, so patient can go ahead and, get reimbursed from the insurance company. And this is a really important medications. So as a provider prescribes, patients can go ahead and collect from the pharmacy that the medication have sent to, And once, if the medical medications gets over, patient have a freedom to send a refill request. So if you ever think running out of medications, patient can go ahead and request for a refill, and provider or the practice can go ahead and re-prescribe it for the patient. So that way, patients can get the new medication, and yeah, so it can take care of them. And supplements too, same thing. If you do prescribe any supplements, it will be listed under supplement section. So it's not only the providers that prescribed, patient can also add their active medication that provider don't know about it. So as I said, it's a personal portal. They can still keep track of the medications that they're taking, but also basically automatically to reflect if a provider, prescribes any of the supplements or, medications. And there are sections like the lab records where patients can access their lab results that are shared by the provider. So once the lab is done, if a provider reviews and signs the lab results, it will be shared to the portal. Once the lab results are shared or anything shared to the portal, patients always get an email notification that it's stating like that they have message, or they have a document that the provider shared, or questionnaires like that. It will not display what it is, but it will definitely notify them that there is something. They could take a look at it from the portal. So once they get here, patients can review their lab results. And also, if there are lab orders that are shared, like for example, some practices who do not have a direct integration with the labs, that they do place an order, but they will share to the portal, so you can go ahead and print, like a download and print it and take a copy in person so you can get the lab done. So for those purpose, yeah, if you go under orders, you can definitely go view and download the lab order that the doctor have placed for you. And image results and image orders works the same way as the lab, which I mentioned. Image orders can be done through the practice and shared to the portal. Basically, if they do place an image order by default, it will show over here. But if you want to print it out, it will be shared, and you can access those image orders from image orders section. Okay, so these are all going under a practice specific. But when it comes to the personal portal, all the sections right below are a personal portal where patients can track their health vitals. For example, if there are like allergies, that the patient is going through, patient can go ahead and put in those data and keep track of it, when it was observed and how severity it is. Okay, those personal information can be entered. And also a health channel. Health channel is the section where if a practice has a Charm Connect, Charm Connect is a feature that allows you to chat with your providers or the practice member. It works more like a messenger instead of an email exchange. If you do have, as a EHRN, if you do have this add-on service, patient can definitely go ahead and chat with one of the front desk or the provider. How would they do it? Under health channel, and patient can start a chat and share any of the documents that they would like to share. It works same way as email, but email is a message is more like works like an email, but this is more like a messenger where David, the new refill. So if you would like to send any message to doctor or to the front desk, patient should be able to do that. But this will be granted, as I said, by getting a Charm Connect feature, Charm Connect feature, into the practice end. Okay, and also patients can input any of the problems list that they're having and the procedures that are being done to the patient. So if there are any blood tests or any surgeries that are done, you can store that information. And also the diet, also the diet that they're keeping, so they can go ahead and keep track of the diets that they're doing. and the therapies and the immunizations that are being done. And also, you can store multiple insurance details. But just one thing is, like, this information will not be shared to the practice because it is a personal portal. It is under personal portal. Okay. And also patients can pull up reports, library, wellness, and growth chart like that. So there are a lot more option patient can play with. So this way, you can have your patient achieve the most, in their health outcome. So it is really, necessary to provide as a practice to whatever the necessary things that patient would need to, overcome the health battles. And one of the another important feature that Charm Portal provides is a share section, which is located on the top of the page. So what it does, share is a new feature Charm has brought, where you can select a facility and instantly share all the sections that are listed on the bottom. Okay, so what I showed you all this time is individually sharing the sections or the information. But here you can choose a member or the practice who you would like to share with all the medication that you input, all the lab records, problems list, diet, immunization, and all these 10 topics. Whenever you input on into the system, it will be shared to the practice and they can access the information. So if you think you don't want to give certain sections access to them, so you can definitely go ahead and turn them off, so that way it will not be shared with them. So I think when we go through the practice management, I think one of our team members will cover that, where you can access it. But definitely, if I have time, I will show it over to you. But yeah, over here, you can go ahead and, save and share all these information. So that way, practice or your provider, whenever they want to capture the information, they can go ahead and check all the data that you're inputting into the system. Okay, so yeah, like there's a patient portal, can benefit mostly and heavily on your patients to share, communicate, and access the information which they want to. I'm just gonna pause a little bit over here to see if there are any questions. All right. Okay, my patients can't view a Super Bowl if I share just through PHR. I have to also share via email. Actually, if you shared via PHR, they should be able to access it. But basically, you have to choose the attachment as a Super Bill, so that way it will send as a Super Bill instead of an invoice. So please make sure that you're selecting Super Bill option, and so you should be able to share it. All right, let me quickly jump back into the presentation. So as you see in the picture, patient engagement do provide all these bells and whistles. One more time, I showed you thoroughly from the patient portal, but just as a quick glance, patients can request appointment or schedule, by themselves. And by scheduling, system will send a notifications or reminders like appointment confirmation, visit summary, and lab results can be shared or notified, prescriptions, and the birthday wishes. That's one of the important ones that you would like to wish your patients that they're happy birthday. And also when it comes to communication, also secure messaging is available, which I showed you a message option. And also there are SMS notifications, email notification, and the chat option, which I just talked about, connect, where a patient can chat and share data with you. And when it comes to data sharing from patients, you can add a flow sheet into the portal where they can share or provide it or fill those information for you. And also they can share the health records the way I just showed you, share option, and filling forms and questionnaires. So once they schedule patient should be able to fill all the documents that are necessary. And once every consultation is done, you can also create a feedback form in the EHR portal, where once you have a consultation, there will be a SMS or email, or through the kiosk they can fill up the feedback form, how the consultation went through or overall. So patients should have a flexibility of filling that up when they have a chance to. And one more revenue generating option is e-commerce. So there are a lot of practices who do sell supplements, who do sell many other products in their practice. But e-commerce gives you a bit more flexibility for patients to purchase those orders. So when they come to see you in person, you can definitely make provide those supplements or sell those products or braces or whatever you do, put in your inventory that you would like to sell it to the patient. You could do that in person, but in portal, we also provide an e-commerce option where patients can purchase those products and make payment and place order, and it will be delivered to their home. So you can go ahead and ship it out to the patient's home. So like there's all the options are built into the Charm system, which will help patient get access to all the things they would need to. And one more important component that Charm provides is health passport. So a health passport, patients can generate a health passport by using our Charm system. So what is a health passport? Health passport is a tool that contains the essential demographic and medical information for emergency situation. So now you can find this under resources, and we can also share if you would like to. Please let us know in the chat box, where as a patient, they can use this link to sign up and put in their login credential. If they're with the Charm patient portal, they should be able to create a health passport here. So all in necessary to log in and put in all the necessary informations like the demographics, the treatments and the documents, or any crucial information they would like to give it to or other emergency situation. Okay, let me go ahead and log in if I can. All right. Awesome. So, okay. So once you log into the your health passport portal, so you can input your demographic section, treatments that are being done, and the documents, important documents, and medical conditions that the patient has, and the current medications that they're with, and hospitalization, allergies, past medical history. So like this, you have COVID screening. So you have many questions that are applicable. Patient can go ahead and fill up and save this information. And once they're done, they can actually download the copy of it. So once the patient clicks download, it will be downloaded into the system so they can keep a copy of their record. So it will create a document for My Health Passport, which they can print it out if they want to, or you can create a URL for that. So this way you can use this link or share to anybody that you wish to. So all the information that I just showed to you, show it over to you. So those are visible by just clicking this link. And also you can create a health card with a code. They can scan it and access it, or same thing, you can use the link to access the patient medical record. So this is the custom branded app that Charm provides, where patients can use this app to communicate, request appointments, view upcoming appointments, and communicate with the providers, and access basically from their cell phone all the features that are mentioned over here. They can access their visit summary, make payments through the app, and view all the announcements that are done, and any useful info that are important for patients to know. So this is a custom branded app specifically built for individual practice. There's a one-time fee and an annual maintenance fee, but these are available both in iOS and Android platform both. So if you think you would like to get an app for specifically for your practice, which it will be posted under your practice name, and the logo will be displayed, whatever the logo that your practice has. So there's also one of the options available in Charm. So if you think that's going to benefit or satisfy your patient needs, I think I highly recommend many practices that use this feature have a positive response on this. And yeah, I think I just talked about Charm Connect and notifications and reminders. I think I already notified. Email, text, and voice notifications are available for you. And as far as it comes to appointment request, online appointment booking requests, and medication and supplement refill requests are available. And I already talked about payment processing. So how you could collect, and send or share invoices with the patient, whether it's digitally, or you can share bulk invoices to the patient. And you can create a patient statements with multiple invoices as well. And another topic is e-commerce, which I just we talked about, where you can actually create an e-commerce add-on, or you can grant this access so you can bring in more revenue for your practice by patient purchasing all the products or the supplements that you do provide. So basically, if you see all together a patient engagement journey, if you from a pre-visit to continuity of care, full cycle of a patient, consultation process that happens with your practice, everything are built into the system and provided over to you. So it is all about, patient using all these features. So, pre-visit, all the sections are mentioned over here. During the visit, you have a kiosk where patients can check in and get the consultation done. With the post-visit, health data can be shared to the portal or survey and chat with the clinic, secure message, and handouts, anything that you would like to share it. And also follow-up reminders. Yeah, that's one of the important ones. When you are a provider, you can set up a follow-up reminders for the patient. So that way the system will automatically remind the patient to reschedule with the provider. So if there's any lab order placed and done, you can set up a follow-up reminder. So it will send out an email, text, and voice reminders, letting them know that to schedule with the provider again.